Since you've been working with me. And really, let's take it one step further because I like this next slide a lot. This is the one maybe of all the slides that resonated with me the most of seeing where all this multifactorial elements come into play. And I'm only saying that from the standpoint because I know recently I saw you for basically a pain in my neck, right here in my trap, and yet I remember the first time you were working with me, you did nothing to the left side of my trap. You did a whole bunch of other things, but you didn't do that. That's because of what we're about to see next is with this, and I like this. So let's pull this up where you can explain this because this was probably the most eye-opening thing that I learned from working with you and certainly with my patient care.
Yeah, so I know this is a difficult image for people to see because it's got so much on it, right? But each one of those kind of color codes kind of would correspond to like one of those three diagrams that we just saw in the previous. So it's just broken down into much more detail, right? And then every person, those little circles would be different as far as which one has more value. And so, if we're now kind of going to break this down, some people might have a bigger like green zone, some people might have a bigger purple zone, and then within the purple zone, a couple of those factors might really stand out, whereas some of those in the like the red or the other colors might be less. So it just goes to show how many different things are contributing to the pain experience. And we can't just say that your rotator cuff and your supraspinatus tendon, that might be like one of the factors, but we can't say that that is the only thing or that is the thing. And if we just fix that, everything's going to be better. Because the rotator cuff tendon would just be one of those bubbles.
Right.
But all of those things are contributing in some way. And so if we were to make a pie chart and we were to say, it's like 0.2%, 0.3%, 0.7%, and then just break it down into how much each one of those are contributing, they all add up. And so the goal would just be, where can we create the most leverage and try to check that box and then just keep moving on to the next one. But like in your case where we were working away from the kind of site of symptoms, where you hurt isn't always what's causing.
Correct.
And so I always like to, especially if something's what I would call hot or pretty aggravated, if I get in there and I'm digging on that area, we're just agitating it further. But if we can find a place of dysfunction that might be maybe not moving as well as we would like, or maybe something's just not quite right in a distal area, but if we can improve there, and then we come back and we check the area that was hurting, right. A lot of times if we make progress in an area that didn't hurt but wasn't working well, whenever we come back to that area that was painful, it's less painful. And so it just goes to show that we don't have to always address the pain directly.
Correct.
Because of all of those different factors, we can actually create a decrease in pain by focusing on some of those other bubbles, right? And by focusing on some of those other factors and by decreasing the pain, we actually increase our level of success, because you're going to be like, well, everyone else that I've been to has just dug their thumb right into the area that hurts.
Right.
And I don't want to hurt. So if we can do a funny exercise that might not look like anything you've ever done before, it might allow us to make progress in an area that you're not really used to, right?
Absolutely. So as we move on, let's bring into now. You get on this topic of reassurance
Yep.
versus reactivation. What do you mean by that?
Yeah, so I think a lot of times when patients are in pain or they're in they have dysfunction, um, we need to reassure them that they're not broken, that they're more resilient than they realize. And just because something might be a little aggravated or limited, it doesn't mean that they can't still perform activities that they enjoy. And so,
Right.
a lot of times, if we, if you have a painful shoulder, like in your case, if we would have done an MRI, this kind of goes back to that perfect diagnosis. Um, if we are trying to look for the perfect diagnosis, and we did an MRI, and we were able to see, oh, there's some inflammation of the rotator cuff.
Correct.
Okay, well, that doesn't tell you that there's pain there. It just tells you that there's a little inflammation. And typically we associate inflammation with pain, but it doesn't necessarily mean that it actually is painful. Um, so if we were then to target that inflammation, but your shoulder still hurt, you're going to be like, well, what the heck? So by reassuring you that just because it hurts doesn't mean that you still can't, or it doesn't mean that you still can't participate, because if you enjoy you know playing the guitar and your shoulder strap is
Right.
really digging into that left shoulder, um, you know a lot of times whenever someone's in pain, the first thing is, if it continues to hurt, they think it's actually getting worse, as far as like there's more tissue damage, there's
Correct.
more inflammation, and really it's more just that the body is trying to like give you this signal, like, hey, we might need to do something a little different. And
Yeah.
that's really what that kind of gets at, is like, we need to change the behavior
Right.
and reassure the person that we can modify, we can adjust, but it doesn't mean that you have to completely stop what you're doing. And I think that's everyone's fear. It's like, well, I enjoy playing pickleball,
Right.
but I'm afraid you're going to tell me that I have to stop.
Right.
The goal is, how can I keep you playing pickleball with really minimal limitations?
Right.
It might mean you need to warm up more, or it might mean, hey, we're going to limit it to 20, 30 minutes, and you might need to kind of take a break in between, but it doesn't mean that you can't, not play.
Yeah, and let me make a point to that just for our viewers. When I came to Josh, also my shoulder was something that recently happened, but he's been treating me for a little over a year now. Something that's been off and on with basically my right hip, particularly on the internal rotation, that's we discovered.
Right.
But to your point, we discovered where pain would really kick in for me. It was kind of after 30 minutes, and actually the pain wasn't in the hip; it was in my ankle, of all things. And so, but that's where you were like, you know what? I feel comfortable that you've got all the stability you need in the joints between your hip and ankle. You can clearly walk 30 minutes, because I was trying to push myself to go into longer distances.
Yeah.
And then you just flat out says, like, look, we'll just play it safe. Why don't you think about maybe walking twice a day, morning, evening? And that's what I've been doing. So I kind of kept myself at around that 30-minute mark for now. I mean, to be honest with you, this past couple of weeks have been actually going up to 40 minutes, and just feel great. So I think, to your point, um, I love the fact that you didn't say, "Hey, stop walking." You just said, "Hey, we just need to be smart about your walking, and making sure you're also aware of your gait, and if there's any changes in your gait as you get tired, things like that." So again, I just wanted to echo my own personal story to say that's exactly what you were talking about, because I've experienced it myself.
Yeah, I think that's, you hear this all the time. People, they go to the healthcare provider, whether it's a PT, whether it's their MD, doesn't matter. Um, the typical, like, the message that gets broadcast throughout is, if it hurts, stop doing it.
Correct.
And it's like, well, we can modify, we can work around it. And I think that's most people's fear of maybe why they're a little hesitant to seek care or even seek, treatment is because they're afraid that they're going to have to stop, and it's something they enjoy. So the
Right.
goal is to keep them active doing what they want to do. Whether it be photography, where you're in weird positions, or whether
Right.
it's playing
Right.
with grandkids. It doesn't matter. But the goal is to keep you as active as possible.
Yes.
And then it's this kind of like parallel path where we need to keep you active, but we need to keep you doing things that you're doing to make sure that you can stay active. Because
Right.
it's not this come in, get treated, and then kick you out the door and then just go right back into, like, we've got to be working together here. And so
Right.
I like to think of it more as like a partnership rather than you're coming to me for me to fix you and then you leave and then kind of be on your way. So whether you want to think about it like golfing terms, like as a caddy,
Yep.
the caddy, they're going to give you the, from the yardage book, they're going to give you, oh, it's 135 to the front, it's 165
Yeah.
to the back. They're going to give you all the details. And then they're going to help you navigate, okay, well, this is the best way to play from our place. Or whether you like fishing and you go out to Montana and you're going to fly fish and you book a fishing guide.
Right.
You've never been out there before. Like you want to catch a trout, you're going to hire someone that helps you kind of along the way.
Yeah.
Or you're a runner, you're planning to do a 50K, in the fall. You need a plan to make sure that you're executing the proper strategy so that you make sure you finish, you make sure
Yeah.
that you don't get hurt, and you make sure that you're able to kind of perform the way that you want to perform.
Yeah.
And so this guiding process is really how I kind of see myself, rather than the white knight that kind of comes in and saves the day. Because I think that's how most practitioners or healthcare professionals, they kind of slot themselves more into that category where it's like, you need to come to me so I can fix you,
Right.
and then you have to come back to me so that you're able to kind of do what you need to do. And it doesn't mean that there's not maintenance. Of course there's maintenance. There's always going to be this level of where you're going to go do what you want to do. You want to go hike the Grand Canyon. You might come back a little banged up. Your knee might hurt, but we're going to have a strategy that we're going to get you back to where we need you to be. We're going to give you strategies to get beyond where you want to be, so that next spring, whenever you want to go, hike Angel's Landing in Utah, that's a pretty challenging hike, that you're going to be able to do it, with a little bit of recovery. So it just goes to show that there's a little bit of a different approach than I think what is commonly held in the traditional kind of rehab or physical medicine space. So,
Well, I think there is, and I think what you hit the nail on the head is, we all, in living our lives, there's certain goals that we have and we want to achieve them. I know for me, it's weight loss, and I know that after I've been doing it for quite some time, and after losing 80 pounds, I know I need to go longer distances. And my body wasn't quite letting me, which is why I came to see you. But at the same time, you were also understanding what my goals were, and that I knew that I needed to, up my level to be able to do this. And that's, talk about guiding. That's, I would say that characterizes you very well in terms of, that's why you take time with the patient, especially in the early stages, right? In kind of discovery phase of getting to know them and really trying to figure out what their goals are, what they want to do, then certainly what's maybe holding them back at this particular time. So, yeah, I'm just saying that I just know I've experienced that with you, absolutely. So with it, here's one of my favorite slides, and why don't you talk about this one?